like it's like literally like that part right there, like that part right at the top, apex. All right, there's a small opening on each apex that allows passage of blood vessels and nerves into the tube. This opening is called the apical foramen. Now, they may not ask you on the test, but I will say I have seen, it's like every once in a while, it's rare. It is very rare that they might say the foramen, apical foramen. So you can just write that down just to kind of know. But apex is the one that you need to know right there, tip.
Easy way to remember apex is the apex of a mountain is the same way, right? What's the apex of a mountain? The very top, right? So it's always going to be the very top of your tooth. Right now, what it's basically saying is your apical foramen is where the apex goes into your, right into your pulpal canal, and that pulp is the life of the tooth, where you're going to feel the pain and sensation.
See how like they got that right there? So trifurcated, it got 3, bifurcated 2. I got that looked up. Y'all good? All right, enamel. Enamel is a calcified substance that covers the entire anatomical, I don't know why it's written like that. Basically, it protects the dentin. You need to know that piece. I'm trying to figure out how they usually word it.
They talk about protecting the dentin.
Color may vary due to it being translucent. The hardest tissue in the human body, star that one right now, write it, star it. Approximately 96% inorganic material, 1% organic material, and 3% water. I have seen
The
they
inorganic.
worded it like that. They worded it just like that. Like how much inorganic, organic, and water is
Mostly it's the 96% one you're going to see on the test.
Yeah. The pressure, the PSI, that's good to know, but I don't think they asked. Once formation is complete, the new enamel cannot reform. So that part I would know, but I doubt that they like ask the question in there. But they may put that with something else and just kind of throw you off. Once y'all got all of those ones that we talked about starting and stuff like that, look up. If I start moving too fast, let me know. I'm like one of those people that drinks Red Bull and the next thing I just start talking a mile a minute, all right? All right, we're not gonna do that. I'm not worried about that. All right, dentin. Yellow, light yellow substance, write that down. Harder than bone, less dense than enamel, and very porous. Star that one. Largest portion of the tooth. Approximately 70% inorganic matter, 30% organic matter, and water. Dentin is living tissue and can regenerate. So they may ask you on the test which one can, which one can't. So which one can regenerate or reform? Dentin, exactly.
Which one can't?
All right.
So enamel is that outside covering, right? That's what breaks first. And that's why, and the easy way to remember is enamel is what covers the dentin, or protects the dentin.
They might even try to confuse you with the part about like which one is harder and all this other stuff. But the part that you want to look for is very porous. So the porous is obviously this isn't the hardest one, but they may say the question may say harder than bone, or it might not say that the enamel is the hardest. It just might say harder. But then once they throw the porous in there, porous is with the dentin and not with the enamel. Does it make sense? All right. Once you got this, look up. Like right now, we already went over like 5-6 questions that's already on the test. Make sense? All right, cementum, a bone-like tissue that covers the roots of the teeth. Cementum joins the enamel at the cervix of the tooth, forming the CEJ. They may ask you what CEJ stands for. The primary function of the cementum is to anchor teeth to the tooth socket in the periodontum. Cementum is continuously formed throughout the life of the tooth to compensate for the loss of tooth substance.
Again, anchor, and it's covering the roots of the teeth. So think of cement blocks basically almost around your teeth, holding it in place and keeping it stable.
CEJ?
Cemento.
What is the cementum?
Cemento enamel joint.
Yeah.
Or junction. Sorry, I think it's junction.
Junction.
Which junction and join are the same kind of terminology.
Once you got to look up.
So this is basically like the glue that sticks the tooth into the jaw.
Yes. Because if you think about it, how many of y'all, you just watch TV, you know, like they just take the tooth, like they'll like grab it and then all of a sudden it can just pop out. It can. But not that easy. You know what I mean? Because you have cementum. And then your teeth are connected to the what? What part of your bone? Alveolar bone. You see what I'm saying? All right. So we tracking? No, y'all just writing notes. Y'all like, I'm not listening to this dude. All right, cool. All right, dental pulp. All right, dental pulp is soft tissue inside the tooth. The pulp chamber contains dental pulp. All right, so this is the pulp chamber. See all this red right here? Pulp chamber. Pulp chamber.
What's not on that slide that needs to be on there that's on the test? It is the pain center of the tooth.
Pain center of the tooth.
It is the life of the tooth.
So dental pulp, primary function is to form dentin and provide nourishment to the dentin. All right, so if you look at this tooth right now, what part is this right here? So the part that I'm circling right now. Crown, right? Because you can see it. See how you got the gum right there? But the crown goes all the way down right there. So when you go get your cleaning, you get that popcorn kernel stuck right there, that's the part that they're scratching. Now if they start getting down here, that's the reason why it starts to hurt a little bit too much. But if it went down that far, it's not the hygienist's fault, that's your fault, because your gum should be attached. Your gum shouldn't be all loose for them, like you shouldn't even be getting popcorn kernel down there, all right?
I want you to pay attention to this when you're studying for the test, because it's going to answer a few questions just staring at this diagram right here, right? So, knowing how it all goes together. The enamel encases the dentin protects the pulp, and if you have seen, which part looks like the largest? Out of enamel, dentin, and pulp, which one looks the largest? Dentin, which dentin is the largest part of the tooth. So if you're trying to figure out how it goes and that the enamel protects the dentin the largest tooth, stare at the diagram of this and it makes sense on trying to retain all that information.
What did you say that wasn't on the slide about the dental pulp?
It is the pain center of the tooth, or I call it the life of the tooth. Basically, if your pulp dies, your tooth dies.
Yep. So basically, I'm gonna go over this little piece. So if you look at your tooth, most of y'all go in there and you're going to dental hall. My tooth hurt. It's sensitive to heat or hot or cold. The reason for that is because your enamel is basically gone. It started to go through the dentin, and then now it's messing with that pulp chamber, right? Now that pulp chamber, after a while, starts to die because it's coming from that blood that's coming through the what? The apex. Yep. The apex of the tooth, you know what I mean? So all of that stuff, this is why all of that stuff goes in, ties in together. So now you're starting to mess with that pulp chamber. That's the reason why it's starting to hurt. A lot of people just think, oh, my teeth is just there and it's just a bone and it's not connected to nothing. No, you have a whole blood vessel, you know what I mean, to a certain degree, basically like running through your tooth. Does it make sense? So that's the reason why. You ain't just got like some little rocks that's imaginary and they can crack and they don't hurt. No, you crack them things and you cut through to that pulp chamber, it's gonna hurt like hell.
That's how we can have a good assumption of what's going on with you too. Basically, literally how you describe how your pain is, which we will again learn on another PowerPoint. We know that if the pulp is being affected or not, if it's a dull pain or a sharp pain, based off of that.
All right, alveolar process, the bony portion of the maxilla and mandible where the teeth are embedded and tooth roots are supported. The alveolar socket is the cavity with the alveolar process in which the root of the tooth is held by the periodontal ligament. Do y'all understand what that is, or do you need a little bit of explanation?
The first one is how they're going to word it on the test. They're going to say bony portion of the maxilla and mandible where the teeth are embedded, and they're going to say, what is this? And it's going to be your alveolar process as your answer.
It's basically where the hole where the tooth should be.
So alveolar socket is where it's attached. Alveolar process is like when it's actually in there. Does it make sense? So the only difference is the process is where it's supported. Alveolar socket is the socket once the tooth is taken out. You got the actual socket. It's gone.
Like the gum.
So if you ever feel, not to be weird, but if you ever feel by your teeth, right here, there's this little portion that goes right down here.
Mm-hmm.
That's your alveolar process. That's the bony portion to where everything is just held into there, right? And then you have a socket within each of those tooth that holds it within that bone. So it's almost like you have a piece of wood going across with little holes in it. That piece of wood going across is your alveolar process, and then each of those holes that the tooth goes into would be your alveolar sockets.
Y'all got that? Y'all got it looked up? All right, periodontal ligament, a thin fibrous ligament that connects the tooth to the bony socket. So basically, your periodontal ligament is right here. So you know how you got gums? You got your gums, right? And then you start to feel like that little popcorn kernel in there. If you go way below the gums, that periodontal ligament is the part that is basically attaching your tooth. So if you go to wiggle your tooth, your periodontal ligament ain't doing its job. Does it make sense? All right. Normally teeth do not contact the bone directly. The tooth is suspended in its socket by the fibers of the ligament. The fibers act as a shock absorber. So anytime you bite down and then you start to feel something, you're like, it's usually because your enamel is messed up that's starting to go through your dentin. But if you bite down or your tooth starts to feel high, now that means that it's not the top part of your tooth, now it's like at the bottom. You know, now you got something going on down here. So your periodontal ligament is tripping. Does it make sense? So you got a little shock absorber in there. Y'all understanding like what they are? So for the test though, periodontal ligament, basically the shock absorber. The thin fibrous ligament that connects the tooth to the bony socket. All right, tissues of the oral cavity. The oral cavity is covered by the oral mucosa. It consists of 3 parts. All right, the 3 parts are masticatory, masticatory mucosa, lining mucosa, and specialized mucosa. All right, so masticatory covers the hard palate and the gingival. Light pink in color, can vary with skin color. The lining mucosa covers inside of the lip, cheeks, vestibule, soft palate, and under the tongue. Go ahead.
This is how we know you a liar too.
Yes.
I'm just gonna tell you right now. So it's supposed to be light pink in color. So if you come in there with some red gums and you say, nah man, I brush my teeth every day, I floss all the time. Okay. Because we know you aren't if your gums are gonna start to get bleed. And they're like, oh, the dentist made my gums bleed. No, they bled because they were irritated and agitated because you weren't taking care of them, either flossing in between your teeth or brushing effectively or without hard bristles.
That same face you making, I'll make the same thing.
Yeah, so we know. We know what's up when you come in and your gums aren't looking that pink, light pink that they should.
Yeah. Right here too, though, it says can vary with skin color. So if you have a sailor that is dark, like very, very melanated, then sometimes their gums will do the same thing. Their gums will be very dark. But you still understand the difference between the two because you still understand what healthy gums are and what unhealthy gums are.
It's more like a purplish color on
Yeah,
African Americans, but if you know they're infected, it'll be a darker type purple.
Mm-hmm. Yeah. That good? I got it? If not, hold on. Keep going. And then we'll try to move it. What you eating? You be reaching. You said pecans? Yeah, they talking. Pecans.
Pecan pie.
Where you from?
India.
Huh?
India.
Oh, fine, never mind. I take it back. All right, gingiva covers the alveolar process, firm and resilient, circles around the neck of the teeth, protects the alveolar process and the periodontal ligament. Periodontal ligament's bacterial invasion. Healthy color ranges from pink to dark shades, purple or black. 2 types of gingiva are unattached and attached gingiva. So that needs to be highlighted. Covers the alveolar process, firm and resilient, and then protects the alveolar process and the periodontal ligament is bacterial invaded.
So I understand attached and unattached. So your attached gingiva is kind of what's already at the bottom of your teeth right here, protecting it. Your unattached is where you can develop this pocket. So there's a little part that's right above on there. So if you ever get a cleaning and they say talk about supragingival and subgingival, your hygienist can go right underneath the gums for subgingival, and that's going underneath your unattached gingiva to get the tooth surface. Do you have that picture real quick? Let's go back real quick. Where's the other one? I like that one better. That one.
Yeah.
All right, so you have your attached gingiva, which would be this little pink, the lighter pink here, right here, and your unattached would be like a pocket around the tooth, right? Because you still have tooth surface right here. So if a hygienist wants to clean your tooth, they're gonna go subgingival right underneath that darker pink there, because there's still teeth surface there, and clean it to where nothing's gonna make your gums red and infected or
So it's just a little skin
bleeding.
between the teeth, right?
Yes. So, alright, so think of it like this, right? Y'all already see how, like, just like how H1 said it. So you got the attached, which is that little pink piece right here, but then the unattached is like when your gums start to feel swollen. You get what I'm saying? You know how like you get that popcorn kernel and you go in there and you start flossing, but you can feel your gums feel like a little flappy? Y'all know what I'm talking about. Like everybody in here in class 1, I know for a fact. So when your gums start to feel a little flappy, like when you're going in there and you're trying to get in, you're like, that hurt my gums. That's because your gum is unattached because you're not keeping it 100% healthy. So like it starts to get that pocket. You get what I'm saying? The fact that they can get, alright, when you go into dental and they start reading off those numbers, right? They go 1, 2, 1, 1, 3, or whatever.
If you hear 3s and 4s, you're in a bad situation.
Those are the pockets that they're talking about. 1, 0, 1 is good. 2 and 3, you start at 3, 100% is bad. You get what I'm saying? But
0s is perfect.
They're talking about how attached or unattached your gums are, how deep your pockets are. Does it make sense?
So they have these little notches on the Explorer that count for each millimeter. So basically, however far down that notch gets when they stick it, that's why they're like, why are you poking my gums? They're seeing how deep those pockets are. And they can barely get in there, it's going to be a 0. If they can get all the way in there, it's going to be a 4. So a lot of your chewers and smokers, or your chewing tobacco and smokers will have those deep pockets already.
It's even more. It goes further on the scale of civilian.
Oh, I'm sure it does.
Not many, it's opposite.
Yeah.
I'm sure the Marine Corps probably fall on that scale.
Yeah, I seen 5 one time. I said, alright, unattached gingiva, also known as free gingiva. Write that down. Not directly bound to the tooth. In a healthy mouth, this portion is approximately, we're not really worried about that. But remember how we was talking about those numbers, that 1, 2, 3? That's what they talking about right there. 1 millimeter, 3 millimeters. Alright, gingival margin, not worried about that. Gingival sulcus, that's not on your test. Epithelial attached. Interdental papilla. I don't think they talk about that either, no.
If they do, it's this one right here.
The
Yeah,
triangle.
so interdental papilla, write that down, the triangular space near the gingiva below the contacts of teeth. Helps prevent food from packing between teeth.
I like to think about it like ribs. You have your intercostal space, so like in your teeth, you have your interdental. So it's like an
So
yeah.
yeah.
It's just your anatomy.
So that's that space you were talking about, the one like in between teeth. There's a triangular space in between each of them.
Alright, attached gingiva, firmly fixed to underlying bone of the alveolar process. Alright, yeah, that was good. Yeah, we gonna talk about this one.
We'll show you a chart on this because I have an easy way to help y'all remember primary. Actually, where's that chart? I think it's one of the next slides. That one. Yeah. So, again, your primary teeth are going to be your 20 teeth. Know that, right? And they are labeled by letters. Okay? Easy way to remember it. Again, you don't have third molars. So you have 3. So we'll go by each arch. In a primary here, you have your 3 third molars. So your wisdom tooth is right back here hanging, right? Then you got your 2 premolars, your canine, your 4 incisors, and then it goes back the other way, right? So basically, if you any of you have kids and have seen this, right, they'll start complaining of pain or when you were a teenager, when those actual bigger molars are coming in or erupting through your gums, right? So basically, your kids aren't going to have any of these big bad boys here.
Yeah.
They're only going to have premolar to premolar and premolar to premolar.
Yeah.
And then it goes, if you ever had an x-ray, you start from the right all the way to the left, down, left to right, right? So start here and go A, all the way to J, down here to K, all the way back down here to T. Okay, so right to left, and then left to right. Same way with the numbering.
I always think about it like kids can't chew all their food. Every time I think about this, I think about like my niece. I remember she was eating chicken and she just had food like all up in her teeth. I'm just like, ugh. But it's because she ain't got no molars to really crush it up. All right, we'll go back. So dentition. Normally, I don't know why they write it like that. Normally humans develop 20 deciduous teeth, which is their primary teeth. So write that down. 20 deciduous teeth. Deciduous is their primary teeth. So deciduous and primary teeth means what? Your baby teeth. Your baby teeth, write that down. Alright, and then your adult teeth are your 32 permanent teeth. So, your baby teeth is also called what? Deciduous teeth, which are also your primary teeth. Alright. Everybody already know that the arches, you got your maxillary and then your mandibular arch, correct? Alright. Maxillary being which one? One on top. Alright, cool. Hey, look, I'm just checking. Some of y'all even on the wall. We're not really worried about the quadrants. Alright, types of teeth. Alright, so you got your incisors. Used to incise, which is cut food, gives a shovel-shaped appearance. I think sometimes on the test, like they talk about incisors is the what? Cut. Alright, you know. Cuspids, which are your canines. So that's how it's like labeled on the test. Your cuspids look like what, or they're what. Then you got your bicuspids, which are your premolars. Has 2 cusps. And then your molars, there are 3 different molars, all different sizes. It's used for grinding and chewing solid food. So they may ask, you know, what is this tooth? What is it used for? And, you know, sometimes like they might ask for shape. I haven't really seen shapes though.
So I know that some of y'all never do this, but anybody that bites nails or rips open plastic with packages, you ever realize you struggle if you do it with the back of your mouth? You're like, ah, man, I can't get it, right? Because those aren't made for cutting or tearing, right? So if you're trying to actually tear that open or bite your nails, you'd probably be using your canines here to actually get a bite down on that surface to do what it's supposed to do. So your incisors, you have 4 here. You have canines on each side, and then you have your bimolars, or your premolars and third molars on the other side for the chewing and grinding.
Alright, universal numbering system. This is the one that we was talking about, kind of like walk back. Alright, so the primary teeth are identified alphabetically. So just like H1 was saying, you got A through T. Starting with the right maxillary last molar, which is the A, and then move into the left side, maxilla, last molar being J. So basically, just like how he was saying, you start at the top left, work your way over to the right.
Top right,
and then
top right, all the way to the left.
yeah.
You pointed
My
at the
bad,
right.
my bad. Y'all know what I'm talking about. And then same thing with the permanent teeth. All right. Do I need to go into those? So baby teeth is identified by what? Like how is it numbered? Letters, alphabetically. And then your adult teeth, numbers. All right. All right, knowledge check. So how many primary teeth do humans have?
20.
All right, here we go. How many permanent teeth? All right. And then they already asked how is it identified. All right, 2 surfaces. All right, so this is where things about to get kind of weird. All right, and I just need y'all to pay attention. Pay attention, and we're gonna work through it because some of this stuff is going to be on your test. They may throw like these little letters and stuff out there. All right. So facial meaning faces towards the lip of the cheek, towards the lips or cheeks. This surface is seen when a person smiles. So that's the facial side of your teeth. So when you smile, cheese, the facial side. Does it make sense? Facial side, lips, cheeks, facial. Even if I kind of smile like this and pull my cheek back, that's the facial side of that.
Technically, your cheek side is also called your buckle
Yep.
side.
They might have it, yeah. So you can put that too. You know, cheek side being buckle side.
Which is easy to remember because a buccal swab is what? Side of the cheek.
All right, so mesial, the surface closest to the midline or the middle of the arch. So mesial, going in, make sense? Mesial. So my incisors are mesial to my, you know what I mean? To my molar. Does it make sense? All right, I'm just trying to make sure everybody on the same side. Distal, the opposite of the mesial surface. So if mesial is for the midline, distal is what? Away from it. Gotcha. All right, lingual, faces towards the tongue. So you got the facial side, so lingual would be on the other side of that tooth on the inside, towards the tongue. Does it make sense? All right. So occlusal, a broad chewing surface found on posterior teeth. So occlusal surface is the part that you chew with. So if you got your teeth and you're chewing, that's the occlusal surface, that top part, the occlusal surface. The reason why the 2 surfaces play a role is because they may ask you, what is a class 3 MOD or I'll say
They won't ask
MOD.
that on the test though.
Yeah.
They will not get that
So
detail.
what was it? So they did do.
They ask about what the surface
Yes,
is.
the surface
That's
is
about
good.
as detailed they're gonna get. And just think of, I know you're probably gonna laugh at it because he did it last time.
My bad. That shit was my thing.
I know he did. I laughed at it last time. Just think of A Star Is Born, where the Lady Gaga with a line down her face. Right there is your midline, right?
Yeah.
So basically, naming your surface of that tooth is anything on that single tooth that is more towards that midline is mesial. Anything away from that on that tooth is distal. And then of course you got your facial towards the face, buccal ties the cheek, and then right under here, right next to your tongue is going to be your lingual. You're not going to have a lingual up top. It's going to be everything on your bottom arch, on your mandibular that's facing the tongue.
So just like this, just like how this little diagram is, don't trip out too much. Literally, if you put something right in front of you, you know what I mean? Like you'll understand what it is. So you got occlusal surface, mesial because it's the midline, distal, facial, and buccal. Lingual, so it's just on that side. All right, proximal surfaces. You got two surfaces, mesial and distal, just like what H1 just said. The point where the mesial and distal surface touch is called the contact point. So where your teeth connect when you're trying to put that floss in there, and then it gets caught trying to go in, that's the contact point. Now if you start to floss and you ain't got no contact point, you just ain't got one. So you ain't got no contact point. Make sense? Interproximal space. There are between two teeth, so the interdental papilla occupies part of this space. So if you ain't got a contact point, you just got interproximal space, one another. Occlusion. All right. So basically, occlusion is a relationship between the maxillary and mandible teeth where they make contact. All right. When an abnormality in occlusion occurs, it's called malocclusion. So when you have an abnormality in occlusion, it is called malocclusion. Write that down. We'll go over the other parts.
Yeah, we're running really behind, just to let you know too.
Oh shit. How many more slides?
We have 4 more PowerPoints, and the next radiology was at 10:40 and it's 10:16.
All right.
Just to let you know.
You faster at like knowing what's on the test. So like,
Yeah.
As I click, you just tell me like what to go over because I see it and I'm like, I'm thinking about it, but you got that.
The M's and chemo chapter kind of set us a lot over time, so we're just trying to catch up right now.
Yeah.
Radiology's quick, so if we need to go into his a little bit, it's fine. You can really teach that one in like 5 minutes.
Yeah. Occlusal plane is gonna be real quick, so it's made up of two arches. You got the curve of Spee and the curve of Wilson. The mandibular arch forms a concave bowl like upward. So just like when you look at people's teeth, it just kind of goes up. So two different types of
Curve of Wilson has been on the test. That's why there's a picture of it and the definition.
Yeah. Wish I got that look up. Alright, angles of classification. Alright, so this is gonna be quick. Basically, class 1, normal, right? You see the chin? Class 1. Class 2, retrognathic. Class 2 is retrognathic. That's basically when your chin, when you have the overbite.
Yep.
So basically your chin is under, it's back some. And then you have that overbite. So an overbite is called retrognathic and it's class 2. Class 3 is prognathic, and that's when you have an underbite where your jaw goes out.
Looking like Crimson Chin out here.
Yep. Crimson chin.
And remember too, just quick, right? Because they're gonna use these fucking terms here.
Yeah.
I relate to protrude, and what does protrude mean? Push out or stick out, right? So if you have a protruded chin, it's gonna be sticking out more. So no, protrude with underbite, and then overbite with retro.
Make sure I got those look up. Don't get these classes mixed up, though. Don't get these classes mixed up.
They will ask you at least one of those on the test. I've seen one every time.
Alright, so that was that one.
All right, so we got 8, which is dental examinations. Which that one will be quick.
Yeah.
I'm gonna try to catch us up on speed. We're a lot behind, but we'll make it happen.
Alright, so look, we're gonna try to run through these things, kinda quick. If y'all still got questions and stuff like that, y'all can just call it dental and all that stuff. And then y'all also got Conrad and H on the same way, so they'll answer a lot of this stuff. Alright, what is oral pathology? Well, nah, we're not even gonna do that.
So this one right here, I'm just gonna tell you right now what I've seen on the test, right? And it's gonna be for your lab tech. You're gonna notice this. This amount right here is the same amount of milliliters of urine output daily. So your 1,500 milliliters of saliva is the same exact amount as your 1,500 milliliters for urine output. Chapter 8.
I don't think none of the rest of this stuff is.
Nope.
Yep.
None of it is.
No, what did you say was on the test?
So 1,500 milliliters of saliva daily, and an easy way to remember it is the exact same amount of urine output daily. Just 1,500.
Alright, so abscesses, basically everybody knows the difference between an abscess, an ulcer, and a cyst is, correct? As a cornman? No?
This is one of the few chapters you should be able to relate because a lot of these are the same type of conditions in the medical field.
So the two most common elevated lesions are vesicles and then hematoma, obviously. This is the one that you need to know though for dental. The two most common non-elevated, petechia, round pinpoint, non-raised, purplish red spots caused by mucosal or dermal hemorrhage.
No, small elevation containing fluids, right? They'll use that one on the test. And petechia, they love to throw on there. You learn about petechia in another chapter. I know somebody was talking about it. Just know round pinpoint. So if I'm going to pay attention to a keyword, I'm going to star next to round pinpoint for petechia and elevation containing fluids for vesicles.
What you gotta look up? Alright. No, say, alright, how much saliva is produced daily? You already know. Alright, dental caries, basically everybody know what a cavity is, correct? Yeah, sure. Alright, if you don't, just pay attention to like what the definition is. Dental caries is also known as cavities.
White chalky.
Yeah, white chalky is the one that's gonna be on the test. Everything else, I think is whatever.
White chalky is what is always going to be on there for cavities.
Once you got that piece looked up.
Current caries is the one they like to throw on there a lot. It's basically you got a cavity, they filled it with an amalgam, you still weren't taking care of your teeth, and underneath that amalgam, another cavity formed. So it is a decay process occurs underneath an existing dental restoration. Does that make sense? Okay. Sipience is basically a precursor to a cavity. It is a sign that a cavity is happening. And that's when we will treat them with some fluoride varnish, whatever else, to keep it strong. But it is something that has not progressed past decalcification or breaking down of the tooth. Did you have a question? I thought somebody raised their hand. Knowing how the word is going to help make it sense, right? Pulp, talking about pulp. Asia is usually related to pain. So knowing that, you know what is pain in the dental pulp. And then pay attention to these right here. This is what's going to be on the test.
Yeah.
Pain described as a short, sharp, and increased while laying down or walking upstairs. That is what they will throw on the test, is explaining the pain, and you have to tell them what condition that is.
Once I got that, look up. Alright, pulpitis, we already know what that is, right? Itis meaning of the pulp, exactly.
Just pay attention where it says a dull ache that can lead to a severe pulsating pain,
Yep.
right? Because with inflammation, it's constantly like a constant pain feeling right there. So that's why it's going to be like almost a pulsating pain with pulpitis. It's an infection, almost.
What you gotta look up? Here, abscess.
I'm going to explain this in Barney style because I like explaining it because it makes sense, right? Peri means what? Around. Apic, what did we learn that was? Apex, right? And what is an abscess? Localized collection of pus, right? So say around the apex you have a localized collection of pus, right? There's no room for that abscess to go besides down. So it's going to basically almost push that tooth out of socket, starting to shove it down, right? Now, why did I say that? Patient complains that the tooth feels high when biting and is very sensitive because they're going to feel it high because that abscess is almost pushing the tooth out of socket, where it's going to be higher when they're biting down. Does that make sense? And then the grape is on the test too.
Yeah.
So basically, you're going to see that abscess as a grape on the X-ray. The Corsa fistula I have seen too. Sorry. Corsa pus from the abscess goes in the apex jawbone and drains into the mouth, called a fistula. We should all know this one. You see it on your chest all the fucking time. Necrosis means what? Death. And why is that a problem? Why can't we have something dying in our mouth? What's it going to do? Infection, and then cause the teeth around it to spread and then kill other teeth and living tissues.
Alright, periodontal disease is the most prevalent chronic disease of mankind. It's going to start.
Not cancer, not diabetes. Periodontal disease is the most prevalent chronic disease of humankind.
I think that's it, right?
There's another one. Oh, for this one, yes. Now, don't get that confused, because this is like the shitboard pest management, right?
Mm.
Your most common periodontal disease is marginal gingivitis. So, prevalent disease to mankind was periodontitis, right? Or periodontal disease. And then your specific periodontal disease that was most common is marginal gingivitis. Don't get the two mixed. And of course, I don't know if I keep telling you this. I mean, some of y'all have never taken a test before, but you're going to see this one right here over and over and over again.
Yeah. None of these things on all of them. So make sure you write down NUG, what it stands for, is referred to as trench mouth or Vincent's infections. And then the fact that it's bluish or gray around the teeth. So basically, like when you look at people and they got that little yellowish looking one, that yellow just turned from yellow to bluish or gray. Yeah. So you start seeing that, that's nasty. Make sense? So those two, write those down. Those are always gonna be on your test. Always.
I don't know why I cut it off, but the next slide at the top also explains NUG, and it's going to be described as an unpleasant odor and foul taste in the mouth.
Yeah. I think it's what.
Okay, so again, breaking down the word, because I want to do it to make sense, right? Peri means what? Round. Donto, what have we been learning is? Huh? Yeah, but it's more like a bone, right? When we talk about Donto, we're talking about the tooth bone. And then itis is what? Inflammation. Inflammation condition involves the gingiva, crest of the alveolar bone, and the periodontal membrane. See how just literally breaking down that word can let you know what that answer is going to be. P-corn. That's how you label it too. That's not on there, but I've seen it. P-C-O-R-N is how you label pericornitis. And partially erupted tooth is what you need to know. Inflammation around a partially erupted tooth. Okay, because around an inflammation, perionitis, and then just know partially.
Once I got that looked up.
Canker sores. Okay, canker sores are usually on there. Just know your healing time right here for your canker sores.
17 days. That's on the test. Once I got that looked up.
Just to give you a heads up, Chief, we're falling a little behind. So just to give you there, probably about maybe 20, 30 more minutes.
I'm early. What time do you want to come back at?
I think we'll...
I'm there just another in the building.
Okay, I think we should be done by like maybe 10:45, because I think they break it at lunch at 11. I think 15 minutes should be good enough time for radiology.
I'll be right back. Thank you.
No problem.
What you got for this one?
The HSV, just know the difference between HSV1 and HSV2. Okay, HSV2 is what? Genital herpes. And we already know that most of us have HSSV. I think I don't know what the percentage is, but it's a pretty damn high percentage. It just gets outbreaks under stress and other conditions. What was the other side you just remember? Hold on a second.
This one was just the wrong kind of thing. That was it.
Just know that dental treatment will be rescheduled. So if somebody has an outbreak, you don't want them in the dental chair spreading that. Next slide. Candidiasis, just know it's fungal. That's we need to switch it with that one. I haven't not seen hairy leukoplakia.
Yeah. I haven't seen it either.
Kaposi sarcoma, they do hit on those. So just know sarcoma, we're usually talking about cancerous, and it's going to be a bluish purple lesion. Don't get it confused with your bluish purple on your nug.
Right.
Okay.
This one.
Yeah. So snuff dippers patch. Obviously, it's for those who smoke less tobacco. Nothing else here. So again, just know the words. Adeno is usually talking about what? Glands, right? And then carcinoma. So it's basically it's a cancerous type lesion found in the salivary glands or the palate.
Y'all got it?
I hope you guys know what benign and malignant are. I don't have to explain those, right? Ano is meaning missing. So absence of a single or multiple teeth is anodontia. Supernumerary, meaning there's an additional one. So some people actually retain and keep their baby teeth.
Yeah.
So they'll have supernumerary. I know I've seen the cleft one.
Yeah. I think that was it.
Fail to fuse, maybe. I think that's what I've seen on there. Fail to fuse for cleft lip. And then tongue-tied. So another term for tongue-tied is going to be your ankyloglossia. Okay. I want you to think of these T's as teeth rubbing against each other.
Yeah.
So wearing a teeth of tooth surface caused by tooth on tooth. So double T, tooth on tooth. Impaction, that's your wisdom teeth, right? Basically, they're impacting going against your other teeth, and they get it removed, so they're not going to force your teeth to shift or move or cause pain and pressure on your other teeth. So that's when they will remove them. And then abrasion. Abrasion is just like a normal medical thing, right? It's just the external agent brushing up against it. So if you get an abrasion on your arm, it's the same kind of concept. So loss of tooth surface or tooth structure to the action of external agents. Okay, now erosion. Okay, when we're talking about erosion in like an environmental sense, right? It all involves some sort of chemical process, right? So here, your erosion is loss of tooth substances from chemical processes, right? So the other one was loss of tooth by teeth on teeth for attrition. The other one was external agents for abrasion, and then for your erosion, it's chemical process. Nothing else on that one. Okay, now we're going to go over the next chapter.
No. So remember, while H1 is pulling that up, we're trying to hit some of this stuff, one, because we're behind. But if y'all want more of like an in-depth, like to go into it, let us know. Like you can ask H1, you can ask me. H3 Conahan, she works in dental, so then that way she can probably point you in the right direction too if you need like more of an explanation. But remember, don't take all of this stuff from like what you know, cut all that out and just go based off the stuff that we're going off of, because that's the stuff that's
They didn't give us enough time period.
That's what I'm saying.
Yeah.
There's too much content.
By the way, also, to piggyback back on that, thankfully I have recordings from previous EAPs. I have already broken down when I did have time on all the dental chapters. So if you want to understand something, you can view another recording of that later. All right, so chapter 15. Yeah, you're on chapter 15. All right, so dental health questionnaire, just know it's your 6600/3. They don't really throw it on that much, but most of your dental forms are going to be 66s to match our stuff. All right, types, right? Types are different than classes. types of examinations. It's talking about what that exam involves. Break it down. Break it down Barney style. Your comprehensive exam is the one that you get in boot camp. That's the one that is written in green ink on the back of your dental record. It is a very in-depth detail of what is going on with your teeth, right? Your type 2 is your annual exam, or you'll call it as a T2, where they're just doing a checkup to make sure everything's good to go. Your type 3 is a limited or problem-focused examination. So if you're coming in for pain or have any other issues with teeth, you'll get seen there. Or if you're coming in to get evaluated for possible braces or any other appliance, that is going to be a type 3. So a limited or problem-focused evaluation. Your type 4 is your C-duty screening, right? That's you coming in with your form and saying, hey, I need your dental officer to sign off that I'm a class 2 and that I'm good to go on this next set of orders. Make sense? So, comprehensive boot camp, oral examination or annual exam, limited or problem focused, and then C-duty screening. And we can sign off on your C-duty screening ones. It doesn't have to be a dentist. I think it's usually a question too. So again, we talk about this form. We keep hitting it over and over again. Your Easy 603 is your exam. Your Easy 603 Alpha is going to be your treatment form. Okay, type 4, again, a qualified dental assistant, if you didn't see on there. So we can perform a type 4. Okay, we learned about the suitability screening, so I'm not going to hit on that. You already had that chapter.
All right, dental class. Can I hit this one real quick?
Yep.
All right, so I'm going to go over dental class real quick because I'm tired of y'all calling dental, talking about I'm class this, I'm class that. What's the worst one based off of this right here? What's the worst class? Class 3. Class 3 is the worst class because Class 3 will result in dental emergencies within 12 months if not treated. Class 4, it sounds bad. The reason why we push it so much is because we don't know what your dental class is. We just haven't seen you in a year. That's the reason why we keep pushing you. You might come in a dental, knock out a class, like a T2 exam real quick, and walk out of Class 1. We just ain't seen you in a year. Make sense? So Class 1, no dental treatment needed. Class 2, potential, but not expected to result in dental emergencies within 12 months. Class 3, you will result in a dental emergency within 12 months if not treated. And then Class 4 is patients who require a dental exam. So know the difference between the types, and don't get these classes mixed up with the retrognathic and prognathic. Make sense?
And or your types of fractures.
Yep.
But I wanted to make sure you're not listening to what that chief IDC said the other day.
Yeah.
No treatment needed. So your Class 1, you don't need a filling or a cleaning, right? Class 2 is usually going to be a small filling or cleaning. Class 3 is immediate emergent crap that is going to make you non-deployable. And then Class 4, you're overdue.
All right. So I'm not really going to hit on this because I don't know which ones they really hit. Just know that if you got missing teeth, you got an X.
Yep. And then you get a half an X for partially erupted.
Yep.
So if you don't have a missing tooth all the way, have missing tooth all the way, it's an X. If you only have part of it gone or partially erupted, it's going to be half an X.
So for erupted, like, for like little kids, when they like lose their tooth and then they have another one erupt, is that what you're talking about? Or is it like, hey, this tooth just came out, it's not in its socket anymore, it's erupted?
So for the test, when they're talking about this, like erupted, they're talking about adults. So think of like that little curvature right there. Think of it as like a little gum flap.
Erupt
And
means
the teeth come
fully out of the mouth, right? So your partially erupted would be your wisdom teeth coming in where they're starting to break through, and then they'll mark that as a partially erupted tooth.
Make sense? Amalgam restoration is just showing an outline of the restoration, showing size, location, and shape with black.
Yeah, just know that you're filling it in. It's a shape filled in for amalgam. Non-metallic amalgam is going to be not filled in, so you're just drawing the circle on the tooth. Okay. Your gold, you're going to have your lines.
I don't even think they asked that on
They don't ask a lot of this. Just know if you have dentures, basically teeth, removable partial dentures are basically they get fake teeth that they can put in their mouth. They come in and out, right? So you're just marking which teeth those are for with a line. Fixed partial dentures, those are ones that they just keep in all the time, and it kind of has a post that's already there where they can just pop that tooth on there. Apiectomy. We think so. That one is on the test, but we know what that is, right? What's an AP when we're talking about? Apex, right? Ectomy, removal, right? So, we talked about deciduous and supernumerary. So deciduous, we're going to basically write down the letter on if that tooth is still there. Supernumerary, we'll draw that number or letter there. And then drifted, we're going to show where that tooth is drifted to, and there's a chart of it on there. So if you pull the next one, supernumerary, and then I think I saw a letter somewhere on here where they mark it.
Where is it at? I think it's on the next one. No.
Well, they would circle the letter that is still there.
Yeah.
And then you have your drift, showing the arrows going which way they're going. So arrows going for drift, and then your solid line is going to be for removable partial denture. Again, easy 603 for exam. And we're filling that out during your 2808, your separation, T2, T1. And then for your treatment is easy 603 alpha, which we're going to be marking. So easy 603 alpha, to make it make sense to you, is the equivalent of your SF600. Okay, now we got 2 more PowerPoints to hit real quick.